This is Talk Business and Politics with Roby Brock.
I'm Roby Brock. Welcome to today's Talk Business and Politics. Thank you so much for tuning in. Joined by Ray Hanley today, CEO of the Arkansas Foundation for Medical Care, and Dr. Curtis Lowery, Director of UAMS's Institute for Digital Health and Innovation and an OBGYN. Thank you both for being here.
Thanks.
All
Thanks for having us.
We're here
Roby.
to talk about a couple of health issues, but the first one, I got to get a hot take from you right out of the gate, Ray. Tell me your take on Attorney General Leslie Rutledge's lawsuit against the opioid distributors. Is that a good move?
I think so. I mean, Oklahoma and others sued the drug makers, and now she's gone after the distributors, the wholesale distributors that buy from the manufacturers and ship to the drugstores for not paying enough attention to how much they were shipping to where, and I think that's a ripe area to pursue.
We'll see where that plays out. We've been hearing from the distributors today. They finally got around to responding to us, and they're not happy with that lawsuit, as you might well imagine. Let's talk about maternal mortality rates. That is the main reason I invited you guys here today to talk about this. Arkansas, I believe, is 35 deaths per 100,000 live births, compared to 20.
Third worst in the nation.
Yeah, compared to 20, which is the average for the U.S. Why is Arkansas so much higher, Curtis?
Well, it's not clear. It's a very rural state, with hospitals in the rural area and a long distance to get to urban. We don't have many urban cities like other states, and so they're smaller hospitals and rural area, and women have limited access to prenatal care and limited access to delivering hospitals, and so you add all this up, and probably attributes to the higher death rates that we have in the state.
Do we see statistically that Arkansas has been improving in that metric or getting worse in that metric? Does the latest statistics that we have, does it show improvement from where we were?
Not really. It's not getting any better. I'm not sure it's getting worse. I mean, the data is not as hard as we'd like to see it, but it's clear we're not doing well. And one of the big problems is we haven't been aggressively addressing it. We're one of only 4 states in the union that didn't have a maternal mortality commission. And a maternal mortality commission would be set up to look at all the deaths and then try to figure out what caused the deaths and then do something about it.
To formulate some policies. In this session, there was some movement and progress
there was, and we have a commission now to look at this and work on it, but we also were able to pass, after several failures in the past, a bill requiring posting of alcohol education signs for pregnant women where alcohol is sold or distributed.
This is to address fetal alcohol syndrome.
Absolutely, because the unborn baby can't metabolize the alcohol. One drink can do profound brain damage, and we were successful in getting that done. That's going to help, I think, on some outcomes. I mean, and we've tried over the years to do the things that seem logical. It's access, coverage, education, and Dr. Lowery particularly has worked on the access and the education. Coverage, if you go back to 1987, I was the Medicaid, we only covered pregnant women to 17% of poverty. Otherwise, they went without prenatal care, delivered the UAMS. We were able then to push coverage to 200% of poverty. You fast forward to 2002, Governor Huckabee made the decision to cover undocumented pregnant women once that option was there. His rationale was it's good business. If the baby's born with problems that cost us a lot of money, they're going to be born citizens, and it's consistent with my pro-life views. This came out of a breakfast with the Baptist minister, governor, and the Catholic bishop, which is probably as close as I'm going to come to negotiating the Middle East Peace Accord, to watch this Republican governor make the decision to cover undocumented pregnant women. And then, Affordable Care Act, Arkansas works. Now we're covering people for that, and you've got the study that came out of JAMA that UAMS College of Public Health did. We had marked improvement in black birth outcomes because of that. So we've done a lot of things right, But as Dr. Lowery says, the stats are really bad.
Yeah.
And,
Tell me why, because the statistics show that the risk of pregnancy-related deaths for Black women is 3 to 4 times higher in Arkansas than it is for white women or even Latinos. Why is that?
Well, that's true around the nation as well. Even Washington, D.C. has a very high death rate. In fact, they're the worst area in the nation, and they have hospitals on every corner. So, it looks like one of the major factors that's been identified is that African American women don't seek and get the same kind of care that non-African American women, Spanish and white women. And because of this, their outcomes are worse. Now, they do have worse medical conditions, but not so severely that this can't be made up with some of the health care delivery system improvements. And so that's one of the things. So we just had a meeting up at Petty Jean Mountain in which we brought all the labor and delivery directors from around the state, over 105 women, nurses and doctors were at this meeting, and that was one of the big discussions. We talked about racial disparities, that are contributing to some of these problems, and with the idea of minorities don't trust the healthcare system like other groups of women. So we need to make it more inviting. We need to be culturally sensitive to these issues, and we need to make the healthcare system also culturally sensitive to the issues with women. So there needs to be education on both sides.
Let me back up to the commission that was formed in this last legislative session that will, I guess, be doing a lot of work going forward if we were one of the last states in the union to do this. What will they do? What will be some of the dialogue that they'll help facilitate?
I think they're going to be studying some of the very issues that Curtis has talked about ways particularly to do a better job in the rural areas, to be more culturally sensitive. And, we've got a much different population than we had 30 years ago. You've got a huge Hispanic population in southwest Arkansas, for instance. And it's going to take a different approach and a different understanding of how to relate to these patients and how to work with the medical community on doing, the education.
Tell me a little bit about angels and telemedicine and how this could be potentially transformative for this.
Yeah. Well, Angels is a system in which we decided that the University of Arkansas for Medical Sciences should be a program for everybody in the state, that we should reach out wherever and whenever the patient needs the care delivery system. And technology allows us to do that in a new way than before, because we can video conference and we can collect information and we can reach out and help the systems be prepared for these events. One of the good things about this issue, if there is a good thing, is that California implemented these safety bundles, and in California the mortality rate did not go up like it did in the rest of the country. And so the safety bundles are basically protocols that are in effect. So when the mother develops a condition like blood loss after delivery, hemorrhage, or high blood pressure, preeclampsia, hypertension, these can result in death of the mother. But if you follow these protocols, aggressive protocols, then it makes a difference in death and survival, and not just death, but morbidity, reduction in morbidity. This is much like the aircraft industry has done for decades, in which every pilot in America trains for engine failure on takeoff. Well, every obstetrician and labor and delivery nurse should train for hemorrhage and hypertensive crisis of a pregnant woman in labor. And if we do that, there's strong evidence, very strong evidence, that if you can implement these protocols statewide, then you can reduce maternal mortality, because this happened in California and other states that implemented the protocols and had high mortality rates, and they dove after that. And the technology allows us to help other places implement the protocols faster and support them in new ways that other states cannot do this.
I give you the last word, Ray.
I'm just going to commend Angels. I first met Dr. Lowery 25 years ago when he brought forward the idea of angels and how to use the technology and link up the specialists to the rural doctors doing delivery. And I wasn't sure what he was talking about for a while, but my job was to figure out how to get it paid for. His idea took off, and I think it has made a huge difference in getting neonatology and specialist services linked to these patients and helping some of these women stay in their communities and deliver, and then they can be airlifted to UAMS if they need to be. But I can't say enough good things about his innovation and ability to bring UAMS in this to bear.
I know you gave him the last word, but I want to say one thing.
I'll give you the last word.
It takes people working together. And Ray, when he was the health department director, and now with AFMC, and us working with the health department, and the Rural Delta Alliance, and UAMS, and the legislature, to get things done. If you're a poor state with limited resources, you got to work together as a team to change healthcare outcomes.
I would argue that if you're a big state with unlimited resources, you still got to do
and
the
the
same
only thing
thing.
I would say is I wasn't the health department director, I was the Medicaid director.
Right,
So
yeah.
apologies to the health department. But,
Sorry, Ray.
But it takes a team.
Duly noted, duly
Yes.
noted. Ray Hanley, Dr. Curtis Lowery, thank you both very
Thank
much.
you.
Appreciate you.
Thank you.
That's all for today's Talk Business and Politics. Thank you for tuning in. I'm Roby Brock. We'll see you next time.
Each day, the promise of our nation begins again. Arkansas and America, moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us.
Oh, I love you too, sweetie.
Trucking delivers, or everything stops. And that's what drives me.
I did.
You'll find us at the end of a lot of long country roads, covering over 60% of the great state of Arkansas. Our 17 electric distribution cooperatives are working day and night to provide reliable, affordable power to over 500,000 homes, farms, and businesses, just like yours. The Electric Cooperatives of Arkansas, your local energy partners.